Hi, I'm Mariana. This is for Foundation of Nursing Practice for Module 6. My scenario I picked is number 5. So this has to do with respiratory. So Mr. Jones is a 35-year-old male, and he had a bowel resection 3 days ago. He is on the GSU in room 221. Yesterday morning, it was noted that Mr. Jones required oxygen 50% to maintain blood oxygen of 92%. His lung sounds were decreased in the bases. His cough was weak and ineffective. He required much coaching to use his incentive spirometer, and he was able to generate inspiratory volumes of 400 mLs. Mr. Jones was started on IPPB therapy for lung volume recruitment, and today Mr. Jones states his pain is greatly reduced. He is able to use his incentive spirometer without coaching and generate inspiratory volumes of greater than 1500 ml. His blood oxygen is 94% on room air, and he is able to produce a strong cough on command, and his lung sounds are clear in all lung fields. So what's important from the scenario is that yesterday he required oxygen levels of 50% just to maintain the blood oxygen level of 92%. He had a cough that was weak and ineffective, so his condition is severe. He required coaching for the incentive spirometer, and for those that don't know what an incentive spirometer is, a medical device used to help patients improve their functions of the lungs. And he was also started on IPPB therapy right away. So I'm going to go ahead and call my physician and let him know about my patient's status. Ring, ring.
Hello.
Hi, this is Nurse Ariana. My patient condition has changed. So the situation is he's a 35-year-old male, Mr. Jones. He's in the respiratory unit. He's on the GSU floor in room 221, and he's
What's the background info for the patient?
So 3 days ago he had a bowel resection, and yesterday morning he required oxygen of 50% to maintain the blood oxygen level of 92%. His lung sounds were decreased, and his cough was weak and ineffective. And then he required much coaching to use his incentive spirometer, and was also able to generate inspiratory volumes of 400 ml. Mr. Jones was started on IPPB therapy for lung volume recruitment.
And then did you make an assessment?
Yeah, so yesterday his vital signs and oxygen saturations were high. He was, like I said, he needed oxygen, and today his most recent assessment, Mr. Jones states his pain is greatly reduced. He's able to use his incentive spirometer without coaching, without help. His blood oxygen level is at 94% on room air. He produced a strong cough in front of me, and lung sounds are clear in all lung fields. So I would recommend for this patient to be transferred to a downgrade unit where he can be monitored another day or two. Then he can hopefully be discharged because his condition has changed.
Okay, I will get him transferred. Thank you.
Okay, thank you. Bye-bye. What were your thoughts on this clinical scenario? I thought that he was in respiratory failure, but he just needed to be on IPP therapy and for his lung volume recruitment, and then that's when he got better and his pain was reduced, and he was able to use his incentive spirometer without coaching. He had 94% of blood oxygen on the room air, and he was able to produce a strong cough on command in front of me. What do you think we could have added to SBAR? I think SBAR is fine as is because it provides a framework for communication about the patient's condition with healthcare professionals. What do you think we did not need in the SBAR. I think that every piece of information in the SBAR we need, the situation, we need to know who the patient is, what he's in for, the problem, we need to know what unit he is in, and things like that. We need to know the situation. The background we need to know because we need to know the last lab tests that were taken. We need to know his current medications, his IVs. We need to know what he was in for, his diagnosis, and assessment. I mean, we need that to do is what you see, so what you physically see, and we need to do his vital signs and oxygen saturation to be able to find out if he's in pain or not, or if he's able to produce a strong cough or not, or if he needs to stay longer. And then the recommendation is what I recommended. We need that to offer, because you're the patient's advocate, so you need to be, the nurses need to be able to advocate for the patient. If we did this conversation again, what should we do differently? I don't think I would do anything differently because I followed the checklist of the SBAR. I did everything that the physician, I covered everything that the physician would require of me. And then, do you think the significance of the situation was clearly presented to the physician? Yes, I believe the information was clearly presented because of the SBAR facts. I followed through all the facts of what happened in the patient over the last 3 days. And